Hello, welcome to Oncology Unpacked. I am Dr. Dainik Patel, medical oncologist from Australia. Let's talk about something that affects nearly everyone going through the cancer. Fatigue. Not just feeling tired, but a deep, draining exhaustion that does not improve with the sleep and that can make everyday tasks feel impossible. In this video, I won't ask you to push through. Instead, I want to give you a toolbox to help you to understand, manage and move through the fatigue gently, realistically and holistically. Fatigue can be your body's warning sign, not just a side effects or a normal symptoms. Seek medical help if you can't get out of the bed for 24 hours. You feel dizzy, confused or faint. You become breathless at rest and also having a fever or any other pain or a rapid weight loss. Your fatigue suddenly worsens. These are some of the red flags and you should seek medical advice. Fatigue is personal. No two people experience it in the same way. You need to define your mild, moderate and severe fatigue based on no fatigue score 0 to severe fatigue when score is 10. Scale it between 0 and 10. If you have a moderate to severe fatigue, it is worth bringing to your doctor's appointment to discuss if there is any medically reversible cause like anemia, thyroid dysfunction, infection, depression, etc., which can be helped by the medical intervention. Also, this diary helps you to know when your energy dips, what helps or worsen it, what it stops you from doing. These tracks become a map to understand your body's rhythm and to help your team to support you better. Fatigue doesn't just affect your muscles. It affects your mood, your memory, your soul. Your body is healing. Your mind is processing the uncertainty. Your spirit is navigating fear and the new reality. You might feel foggy, forgetful, tearful, frustrated. This is not a weakness. It's your whole self trying to recalibrate to the new level of energy and the new reality. And it deserves support, not the shame. So you need to accept and respect your body and feelings, to engage your intellect and the resources to improve your experience. Otherwise, you will continue to compare yourself with the old version of you before cancer, and that sometimes brings a lot of frustration. Therefore, journaling and writing down thoughts help to overcome negative thoughts. So let's work through some of the strategy. Firstly, there is the importance of flexibility. You need to prioritize what is important in that day. Energy is limited. So don't cramp your calendar. One major task a day should be enough. Leave a gap to rest. Use a graded pacing plan. Match activity to your energy. For example, if you're going for a shopping, use trolley and take a rest in between. And give a plenty of time before and after. Give yourself a permission to rest after socializing. When you plan this way, you have a less likely to feel defeated. Some of my patients feel exhausted in the afternoon and like to have a nap, but they have a fear of feeling old. I encourage them to wind down and have a 30 to 40 minutes nap in the afternoon. Once you replenish your energy, you may feel better and complete the day gracefully. Your body has a biological clock. It thrives on the rhythm and the routine. You need to have 7 to 9 hours of good quality sleep, but too much sleep can make fatigue worse. Try to wake up at the same time. Change your position regularly if you are in a bed. It helps improve the circulation and reduces the pain. And create a wind down routine to help signal your brain it's time to rest. Now, the next point is very important. Nutrition, digestion and hydration. Hydration does matter. Sip water, cordial, herbal tea or juices depending on how you feel. You should normally drink according to your thirst, but sometimes it may not be reliable. Therefore, it is very important to measure how much you drink. I ask patients to have a 1.5 liter bottle and make sure that you drink at least in a day, unless there is any medical contraindication. When you are tired, food may feel like a burden, but without a good nutrition, your body cannot thrive. So you need to eat regularly. Skipping meal worsens the fatigue. Choose warm, cooked, easy to digest food like a soup, stew, rice over deep fried and the large meals when you are going through this fatigue. Steam or cooked veggies rather than eating raw salad, as sometimes salad is hard to digest and take up more energy. Try small, frequent meals if appetite is low. Sometimes patients try smoothies from the seasonal fruit which they like, or have a meal replacement plan if needed. Always think about how you can add a calorie to the fluid or a food when your appetite is very small, like replacing water with the juice. If you are struggling with the eating, ask your doctor to get a dietitian referral. They could plan out your diet plan according to your preference. Now, you would surprise to know exercise improve your fatigue. Even though when you are tired, last thing you want to do is exercise, because movement improve your blood flow, boost your appetite, ease off your constipation, lift your mood, enhance your energy over time as your body have a positive feedback loop and your muscle start responding to exercise. Remember, start small, simple stretch in a bed or in a chair, breathing exercise, walk around your home and the garden. If your joints are not the best, going for a hydrotherapy might be the good idea. Additional exercise like yoga, tai chi would also help. Breathe in, breathe out, let that be your meditation. When I'm really fatigued after a long tiring day, a deep conscious breath is a moment of peace. I consider it as a celebration breath when you connect to the livelihood. So always remember, you should try different practices and see what feels right for you. This is a journey of self-discovery. Ask your doctor about exercise physiotherapy. Many cancer centers offer safe, tailored program, and even some of the programs are available online. Fatigue affects spirit, so let's care for it. Create a happy corner at your home. It could include calming colors, plant, flowers, soft pillow, blanket, a candle or a water fountain, photos or objects that uplift you. Let this be your sanctuary where you can just be without doing anything. It will give you a place to visit with yourself, to have a coffee or a tea without worrying about exhaustion. Limit your screen time as it can drain you too. Now, circle of safety. You are not meant to do everything alone. You should discuss your feelings with your loved ones and create your circle of safety, which include family, friends who give you courage, people who listen. Surround yourself with those who uplift you, not drain you. Don't be afraid to say no to invitation or expectation that overwhelm you. You are allowed to conserve your joy, and sometimes I personally feel channelizing your emotions help you to feel better and lighter. We are in 21st century and technology has helped many people to save energy. So think about tech tools, online shoppings, apps for reminders, digital calendars. Also, you can outsource some of the tasks like meals, cleaning, gardening. Big physical job, you should leave it for the professionals, even though you have done in the past, because that could be quite taxing to your energy level. Now you know all these tricks and tips, so build your own toolbox. This is an individual exercise for you. Think of fatigue management like a preparing toolbox, a set of gentle strategies you can draw from based on how you feel. Some days are good, some days are bad. So prepare for activity, food, and also the interaction with your loved ones when you have a low energy, medium energy, and the good energy days. Success is not doing more. Success is respecting your body's limitation and celebrating what you can do today. You don't need to do everything. You don't need to be strong all the time. What you need is to respect your body's pace. Healing is not a linear. Fatigue may change your calendar, but it does not define your well-being. Thanks for watching this video. Please like, share or subscribe, and leave any question or comment to guide me for my next video to help you. Oncology Unpacked is with you to give you clarity, confidence and courage. Thank you.